Jnanamaya, Anandamaya Kosha. This is the totality of the personality, and we are addressing to all, not just the symptoms. Whereas in other modalities, we are mainly looking for these are the symptoms. Okay, these medicines you take, and then this say symptomatic healing is there and all. I mean, just symptoms are gone. So it is not here. It is not like that. In yoga therapy, at the outset, I wanted to say yoga therapy is treating from the root. Say from where this origin of this disease. No, there we are. So this we are seeing in the wholeness of this. So that as a yoga therapy students, so we should remember. So we are treating. We are the patient in totality, in all the dimensions of the personality. We are addressing, so that we have to keep in the back of the mind. So for all the disorders, whatever NCDs, the non-communicable diseases we are discussing, so for everywhere this is applicable, and we will discuss a few points on that as a yoga therapy fundamental concepts also in between, but we will focus on the respiratory system disorders today. Okay, so this will cover the introduction and then brief on the respiratory system. So we should know the physiology and anatomy in basic things we should know what is, and then we will be able to address, we will be able to observe the symptoms, and then which are the disorders we should know. What is meant by asthma, what is meant by this sinusitis, so this we should know, and then what is the modalities, how the other treatment module, the modern medicine, how it is, how they are addressing, but in the basic concepts, and then how we are addressing in yoga therapy, how we are addressing this. So we should know the difference all the time at the back of the mind for all these disorders. So here we are covering bronchial asthma, and then bronchitis, allergic rhinitis, and then sleep apnea, so sinusitis, and the yogic concept of disease also. We will have a brief outlook on that, and then therapy, and then this for the respiratory system, this integrated approach of yoga therapy module we will focus. So this is the basic thing. This basically these are the points which we will try to cover today, depending on the time availability. So within 1 hour or 1.5 hours, we will do this. Okay, so basic, the first thing we should know what is the functioning of the respiratory system. So the respiratory system, so see, this is the fundamental to the life. So the basic, the prana shakti, as per the yogi concept, this we are inhaling, we are exhaling. Okay, but this is what we are doing. We are the prana. We are taking the prana shakti. Okay, from the nature, we are taking the prana shakti, and this prana is manifesting in different ways. Okay, so oxygen is there. Okay, oxygen we are taking, and then carbon dioxide we are releasing to the atmosphere. But these are the manifestation of the prana. So then this prana is the basic fabric of the whole creation. So let us see the respiratory system. What are the fundamental things in brief? We will see. So the nasal cavity, the pharynx, larynx, then trachea, there is the windpipe, and then going to the lungs. The lungs is having 3 lobes. In the left side, in the left side we have 2 lobes, and the right side, because the heart is there, no? So there are 2 lobes and then heart. And the right side we have 3 lobes, and then alveoli are there, and then this from where it is this what oxygen we are taking, and then going to this alveolar level, and then through this capillaries, and due to the partial pressure difference in the pressure, so the oxygen is getting diffused into the bloodstream due to the partial pressure, and then going to the bloodstream, and then going to the heart, and then from the heart it is getting distributed to the each and every cell. Okay, and then it is in the carbon dioxide that again it is coming back to the lungs, and then we are exhaling, and it is going out. So the system of I think you can mute. Yeah, thank you. So see, the oxygen we are taking and the carbon dioxide is a continuous process, and this respiratory system in the respiratory system, the basic concepts. So basic things, say from the tip of the nose down to the lungs, the inhalation and the exhalation. So this process, if we have with this background, and then how these, which are the basic muscles in this respiratory system. So we should know as a yoga therapy student, we all should know which are the basic muscles, because we are addressing the muscles. Say how we are giving the therapy. So we are addressing the voluntary muscles to control the involuntary muscles, and then voluntary muscles which are directly involved for the breathing, so that we can see. Say this respiratory diaphragm is there, which is separating the chest and this abdomen. There is a dome shape. Okay, then we have the clavicular region, the muscles are there, and then this most importantly the costal, this intercostal muscles are the rib cage, you can see here, and all these muscles, this intercostal muscles, these abdominal muscles, then respiratory diaphragm muscles, and then the clavicular region, this muscle, these all are the muscles which we are addressing, and we are saying doing the asanas, doing the pranayama. So all this we are focusing. So as a yoga therapy student, we should have the basic idea of how it works, how the system is working, and which are the important tissues in the respiratory diaphragm, in the respiratory system. The respiratory diaphragm is one of the most important tissue in the component in the respiratory system. So the respiratory diaphragm, which is a dome shape, the parachute shape, no? So that is while inhaling, it is coming down, inhalation, and then pushing to the this abdominal viscera is there. Abdominal viscera is getting pushed. That is why the abdomen is bulging out. While inhaling, we are inhaling. See, abdominal, respiratory diaphragm is pushing down. No? So then going to the, this abdominal viscera will be pushed in front. So bulging out, the abdomen is bulging out, and then reverse in the exhalation. So the basic things, and then costal, intercostal muscles. See, while inhaling, diametrically outward, there is a movement diametrically outward. No? If you are full inhalation, deep inhalation, inhaling, it is going outward. So outward, inward, these movements. And in the clavicular region also, inhale, it is up and back. Exhale, forward and down. So these are the fundamental basic muscles which which are helping, which are doing this respiratory system functioning, the inhalation and exhalation. So we should be aware of these components. And then this oxygen is say in the atmosphere, say about 20% approximately. And then while after inhaling, so this then in the exhalation, you can see it is around 16%. So that much oxygen is going out and then going inside to the cellular level. And why the oxygen is required? The oxygen is required for burning the fuel and for the energy. Okay. So, and then it is carbon dioxide that is getting released. So, it is a purification also in this, and this respiratory system in conjunction with other systems like say circulatory system and all other muscular system, and this function is going on continuously all the time. So, respiratory system basic things we should know, and before going into the disorders, what are the disorders and what are the modality in the modern medicine, and then what we are offering in the yoga therapy and how yoga therapy is working. All these aspects we will see. So we have seen in the picture that nasal passage up to the lungs and in this thoracic cage. So this ribs, all this we have seen in the first these two. So the basic parts of the respiratory system, we should be aware of this. And you can ask any time, any question, you can just intervene, and then you can ask the questions anytime. Otherwise, I'll be moving, assuming that you are understanding this basic things. So it should not be too slow, it should not be too fast also. Okay. So the intercostal muscles, the ribs are bound together and the respiratory diaphragm. These are the basic components. What we are discussing now, we are discussing how the respiratory system is working, which are the main components, main parts of this respiratory system. So because those parts we will be using in the yoga therapy. Okay. So this you can see the diaphragm movement. Diaphragm movement normally it is 1.5 centimeter, and forceful inhalation it can go to 6-7 centimeter. So like this all these muscles we are using for the say voluntarily we are using, we are manipulating in the various yoga practices. Say in pranayama, you can see in asanas, in other practices also. Okay, so like this. And then there are certain fundamental things. Why the breathing happens, why the air is going inside, why air should go to the lungs. So these things, say vacuum is created in this lungs. No? So how vacuum is created? The respiratory diaphragm, no? The respiratory diaphragm is moving down. The space is increased. Once the space is increased in an enclosed thing, then vacuum is created and there is an atmospheric pressure, you know. So then air goes inside. Okay. So and then while it is during the exhalation, it is getting pushed out because it is coming, it is releasing, it is relaxing. So that down shape, it is relaxing. So this help, the basic structure is for that. So how then this respiratory diaphragm movement is happening? That is from the brain, from the medulla oblongata. These signals are there for movement. Okay, so from the nervous system to the muscular system, and then these movements are happening, and the oxygen is going to the lungs, and then from that oxygen is going, it is diffusing into the bloodstream, and then going to each and every cell of your body, and then this oxygen is used for the burning the fuel, for making the energy. For energy is required for what you ask questions every time. Why, what for that? And energy is required for every activity, for the movement, for the stretching of the tissues, for our metabolism, for everything. This energy is required. So energy, source of energy is this prana. That is what the sages in the yoga they have the concept is that the prana is the basic fabric of the whole creation, and our inhalation exhalation is a manifestation of the prana. There are, you may be knowing, there are 10 pranas. Dasha pranas are there, 5 are the main pranas. So this prana, apana, vyana, you may be knowing, which is I mean for different systems, different parts for different functioning. It is for that. So like that. So then respiratory system we are focusing. So how the inhalation, how the exhalation is happening. What is the basic physiology and what is the basic anatomy of this respiratory system. This is what we are discussing now. So here, if you have any doubt, we can ask in between also. Otherwise, we will continue for a few more slides on this respiratory system basic awareness, so that further you can go into the what are the disorders and how these are addressed in the yoga therapy. Okay. So the respiratory system, the lungs is there. Lungs, what is the lungs capacity? The total, how much air can go inside? So there is a concept of tidal volume, concept of this, say total capacity is about you can say 6,000 ml milliliter, 6 liter is the capacity. So you cannot breathe 6 liter, but there is a volume. The volume is 6 liter. 6 liter is 6,000 milliliter. And then there is a tidal volume, that is inhalation, exhalation, inhalation, exhalation. And this tidal volume is 500 ml actually. Okay. So the 500 ml approximately. So in this 500 ml, so you can imagine air is entering at the tip of the nose and then going up, nice turnover downwards, the throat, windpipe, bronchi, lungs. And in that, when it reaches the capillary, so you are getting the point, the capillary, and then bloodstream, it is getting diffused due to partial pressure of this oxygen and carbon dioxide. And this happens, okay, air is entering because of vacuum created. And once the air reaches the lungs in the bloodstream, the diffusion happens, diffusion of what? Oxygen, carbon dioxide. So this happens due to the partial pressure. Okay. So in this So while so you can imagine from the tip of the nose up to the lungs, the air is going there, but that air may not be participating in the diffusion. So that some dead volume is there. Say in the waiting list. So air is entering, but it cannot reach up to the capillaries. By the time exhalation happens, so it is coming out. So that is around 150 ml. So in fact, only 350 ml is the actually it is the diffusion is happening. So 350 ml in the tidal volume. So that much will be used for diffusion and for this oxygen to the bloodstream. Okay. So that is one point of view. We are just roughly seeing the volumes. What is the lungs volume? What is the normal breathing? Now, over and above that, say you have the inspiratory reserve volume, inhalation. You can inhale more than that 500 ml, up to 500. Within that 500, only 350 is reaching there. But you can have, if with using the voluntary muscles, you can inhale more than that. That is around approximately, this is that volume is shown around 3 liter, 3.2 liter is there. So this much is there. You can inhale further, but by stretching the tissues. Okay. And then there is an expiratory reserve volume also. That is around 1.2 liter. And there is a dead volume, dead volume of approximately 1200 ml, 1.2 liter. This is dead volume. Nobody can do anything. So this is for a normal, healthy young person's values are given. So it will vary with person to person. Okay. So in nutshell, at least one point, say the tidal volume 500, and out of that only 350 it is actually reaching to the alveolar level, and that only is actually going to the cellular level. Okay. So you imagine only the small part of it is going there in the normal breathing. Now, if there is obstruction in the windpipe, in the nasal path up to there, what happens? It reduces. So no, then again you will be trying for inhalation, exhalation, because every moment you have to, every second you have to have this. So these are continuous 24-hour process. So if any obstruction is there, that is where the disorders, most of the disorders are the obstruction in the path of respiratory path, from the nose to the, due to various reasons. So the respiratory disorders, basically for obstruction, and obstruction may be due to inflammations, due to allergy, due to say extra mucus formation, and all this. So the path is getting disturbed, the path is getting blocked or then narrowed. So due to this, and most of this we will see that it is you cannot breathe, then say with much effort of the muscles, and then wheezing, and then all these things there. So most of these cases it affects the breathing. This path is blocked or narrowed down, and then that is the many of the disorders are in the respiratory system is due to this. Okay. So this we should have a rough idea of this lungs volumes, so that we know that what is the normal and what happens in the case of a disorder in the respiratory system. Okay. So you can ask any time any questions, any related to this. We can so that we are clear and go step by step. So in the respiratory system, I have already discussed.
You can ask any question, please. Anyone have any question, please?
Yeah, please clear the points then and there, or you can ask later also. There is most welcome. Comfortable as comfortable to you. So the respiratory system we have discussed. It is in a pictorial view. It is given. So internal respiration, exchange of the gases between blood and the tissues. So see the beauty of it. Say the breathing is in different levels. It is happening. See, say the sages used to tell in different 3 levels of breathing. Say breathing from the say from the skin to the tip of the nails, no. So to that extent. So while doing kumbha, the retention of the air, such descriptions are there. So, but actually it is happening. So air is going from tip of the nose and then to the lungs and then exchange and then going to the blood and then it is going to each and every cell of the body. So each and every cell, cellular level, and then coming back. See, so breathing happens in the whole body. So that is, I mean, that concept you can see, you can appreciate that concept which is in the yogic text. So I have a brief idea of, I mean, fundamental basic things we should know, and these are the points. So, so we should know the basic. This is the one part of our discussion. So, understanding the physiology and anatomy of the respiratory system. So that is what we have been discussing for the last this few minutes. So once we are through, then we can go to the different types of disorders, and then how the what are the symptoms, and then further we will see how what are the modalities in the yogic therapy.
Sir, hope ये चालू है recording.
Okay, so if anything, if you would like to ask, you can ask. Otherwise, we will go for different disorders. We will see the major, the asthma is one. Yeah, pardon.
Previous one, sir. This is the you have skipped one.
So this is the basic respiratory system. So what we have been discussing, the air is say from the tip of the nose, it comes to the lungs and then to the heart, and then it is getting circulated everywhere to each and every cell, and then coming back, and then to say this happens, breathing comes in each and every cell of the body. And why this breathing is required, why oxygen is required? It is for burning the food, for the energy, and this different levels of respiration. So these are the points which we discussed. It is pictorially it is given here. So then we will go to the disorders as we were discussing. Say the nasal path, the tip of the nose. No, this path, if any way if it is blocked, then there is a problem. That is a disorder. So that comes. So in asthma, the I mean dictionary meaning, if you say it has come from gasping or panting. Yeah, it is already there. It is. So the meaning is, and it has come from the symptom. So panting. Okay. So this breathlessness is a characteristic in that. In this. Okay, please ignore this. This slide is getting overlapped, and so some these alphabets are getting hiding. So breathlessness is the symptom, and then due to various reasons like say allergy. So there are different types of allergens are there, and your overreaction of the body, and then due to this allergy, this say more mucus formation, and then this the diameter, this ID internal diameter is getting reduced, and then it is congested, and then you are in the case of asthma, you are not able to breathe. So difficulty in the breathing, the breathlessness, it is all happening. So this is the symptom of asthma, and it is due to a wide variation, wide range of allergens are there. So many allergens, and so this allergy that is, it will just trigger. It can be any so like many of the these objects, many say. Many type of it can be from any organ, be from the say from the flower, the pollen, or from the polluted atmosphere, or say cockroach. So many, a variety, a large, I mean so many things are there which are allergy, and it varies person to person also. And once the allergy is there, then the very overreactions are there. Overreaction unconsciously, you cannot avoid that. So it comes, and then say this swelling of the path, and then narrowing down, and then getting this blocked in the sense, so there is path is getting reduced, and then breathlessness is happening. So the whistling sound, the wheezing is a typical characteristic, and the shortness of the breath. Normal breath, yeah, and you can see with the full lungs capacity and normal case, you can see the breathing here. Very shortness of, because he or she is not able to breathe, no, so shortness of the breath. So this asthma symptoms vary from person to person. So there are so many, and so it may trigger coughing, and there is a chest tightness, or the pain also is there, and these type symptoms are there. But the basic thing, the path is getting narrowed. It's okay. So and there may be swelling. So these all result into asthma. That is the asthma, and it is a very difficult, as if those who have seen the condition, the asthma attack, then it is a very helplessness state is there. So what are the causes of this asthma? What I mean, these symptoms? What is the this? Which is that there are certain things which will trigger the allergens. No? So allergens that will like dust particles, or any. It can be any. It is a variation. It's just a typical example is given, pollen dust, but so many things are there, and you have to find out which is the allergen. And but you cannot avoid also. That is another thing. So many things are there, so you can't avoid all the things in the life. So then how to avoid that oversensitivity? So there all yoga therapy concept will come. So we will discuss that later. So respiratory infections also, then common cold, physical activity, even sometimes, then cold air, so air pollution, so smoke, so many things are there. So then for the inflammation, so the drugs, the modern modern medicine modalities, this inflammatory drugs are there, anti-inflammation drugs are given, and then it is getting reduced. Steroids are given, and then so these are the modalities in the modern medicine. But again, so if it happens, if it then again, if you are stopping the medicine, again this comes in the vicious circle. So you cannot avoid the allergens and then medicines, and then is a continuous taking the medicine. So another aspect is the strong emotions, strong mental state. The limbic system is there, so you are in the brain. So you are, whatever small things comes, you are responding. So then oversensitivity is there. So this happens, this as a habit, not consciously, but it happens unconsciously. So that's stress, and then strong emotions also very trigger to the allergy. So you have got a, so you can see in yoga therapy how you deal with these things. So because the fundamental thing itself is for the mind. So we are controlling the mind through various systems, say through breathing, through other, say asanas, pranayam, various practices. So we are addressing this very effectively in the yoga. So as a yoga therapy student, we should know that where we are. So what are the reasons? We should know the causes, and then these causes how we can effectively address. So strong emotions and stress is a factor for the one of the main factor, or it will aggravate. Even if the allergens are there, this will aggravate. This will add again oil to the fire. So that is a very one of the main things. So which you can which we can very effectively address in yoga therapy. So many other allergens are there, as we have. It really depends, varies person to person, preservatives, and then what all junk food, so many things. Okay, and then there are certain other conditions also, like stomach acid backing up. So that also is there, and these all. But the basic thing is what you are allergen to this allergy or this oversensitivity. That is the main cause. Now that comes from where? That comes from where? From mind. So you are controlling the mind, you are regulating the mind, calming down the mind. So once you are calming down mind with yoga practices, all this we are addressing. So otherwise you are taking the medicine for the anti-inflammatory, medicines and other steroids and all, then go on continuing. If you stop again, it comes like that. No, it's a vicious circle. So this type of non-communicable diseases can effectively we can address by yoga therapy. So try to see in totality, not only just the causes and then symptoms and then causes and what modern medicine is doing, but you see in totality how we are addressing in yoga. So this is with respect to the asthma, and then just I am repeating some of the things. Allergy to the various say objects, even cloth, then so many things. So this and emotional stress. Emotional stress activate the vagus nerve, which can cause contraction of the muscles in the windpipe. So this under some research findings are there. So you can see this parasympathetic nerves, no? So which can some of the practices what we are focusing is there are two systems, you know, sympathetic and parasympathetic. Okay, sympathetic will increase everything, increase the metabolic rate and then heartbeat, pulse. Parasympathetic will just the opposite, it will calm down and cool down. So this balance is required. So we will focus on cooling down. If you are in oversensitivity, you are cooling down. So these type practices are there. So emotional stress, whereas emotional stress activate certain nerves, and this can contract to the muscles in the windpipe. And then person in hyperventilation, in the case of stress, no, he is triggering for aggravating asthma. So this is all. This is a very important point. That is why I am just highlighting. Say in the under the emotional stress not only the say anxiety and other things, but say anxiety, anger, whatever may be. So what happens? What happens to the if you are under emotional stress? What happens to the breathing? What happens to the breathing? Breathing rate reduces or increases? We can interact. We will. I think that will be more increases. Okay, so breathing rate increases, hyperventilation. Okay, so person in the hyperventilation is also a trigger for aggravating the asthma. So all this, so when see emotional is a direct link to the direct factor in the this asthma or this respiratory disorders. Difficulty in breathing, swelling in the spasm narrows the path. So what happens then? Then more energy is required. The person is already weak and he needs more energy. How he will get? And then you are giving with modern medicine, this anti-inflammatory medicines, and then that load is also already there. And then see, it's a vicious circle. If you withdraw, then again it comes. So this happens. So in yoga therapy, how you are addressing the mind. So you are addressing the limbic system. You are addressing for the stress, for emotional stress. So then once the mind is cool, the calm state, then the whole system will follow. See, everything will be aligned. In the endocrine system is there. You might have studied the endocrine system, which is say directly say to the bloodstream. The hormones are going there. Just a second. Some message. Okay, then so this endocrine system, so the whatever hormones are to be poured into the bloodstream at the right time, right quantity, all these things, no, this all comes homeostasis. So the balancing in yoga, in a different terms, it is samatvam yoga. Samatvam is in the physiological level also it is there, in the mental level also is there. So everywhere this happens. So what we are focusing in the yoga therapy is the samatvam or balancing. So what we are saying is we are addressing the mind and coming down. So whereas in the asthma and these disorders, the main contributing factor, I mean, one of the main factor is this, which is that emotional stress. So let us see further. So in this long-term medications are there in here. I mean, steroids are there, and all this. That is the treatment in the modern medicine. And then this airway inflammation, as we discussed, and dilators. So all these no spray, all this. But this once these are for you are treating for what actually here in all these cases you are treating for the symptom. Okay, swelling is there. I will reduce the swelling. Okay, so, but it is again coming. No, the original reason for that is something different. So that you are not addressing. No? So that we are addressing in yoga therapy. We have to. To be very clear, so we are addressing to that, addressing to the mind. Okay, then our sensitivity is reduced, the allergy to that is also it is gone. So it is how we are doing that. So we will discuss later, the modalities, but in the meantime you have to correlate, you have to connect everything like this. So how we are reducing the sensitivity by the various yoga practices. Okay, there are many yoga practices, kriyas are there, kriya. Okay, so we are say neti is there, and then vastra is there. So many. So here say while by practicing these kriyas, shuddhi kriyas. Okay, shuddhi kriyas, you are say there will be sensitivity, no? So say some foreign material is going inside through nose, through mouth. So this, so the mind will be tense. So then after once you practice this thing many times, then that this oversensitivity is reduced. So who is doing this? All this by brain, no, nervous system, brain, mind, you can say. So you are training the mind. So even doing the practices of Shuddhi Kriya for the food pipe. Okay, for the say dand or vastra or whatever. So all this, so but it is going to the brain. No, we are controlling the brain. So the same brain is only giving the sensitivity to the my windpipe, my lungs, my various parts. So the same brain. So the brain is getting tuned. So for that, for what? For this oversensitivity will be reduced and it will become balanced. So that type of thing. That is how the yoga therapy is affecting. Actually, yoga therapy is for the these various practices like kriyas and all. And then there are various levels of working like asanas, pranayama, different levels. I just as an example, I am saying over sensitivity we can reduce by shuddhi kriyas. And how it is reducing, so that is what I am saying. So say you are addressing the, what you have to address, you have to address the respiratory system. So but the respiratory system, this nervous system is same, no, same nervous system. So you are controlling the nervous system. So once you control, that control will percolate to everywhere. You are getting the point, no? Okay, so treatment in the yoga therapy, the modality, the philosophy is different, and it is all encompassing, and it is for the whole personality. It is, we are addressing the whole, not the root, not for the symptoms. Symptom like swelling is there, you put some spray, swelling is over for today, but tomorrow again it is coming. Not that. That is not what, that is what we are doing in yoga therapy. We are addressing the person in totality, and then persons. Now there will be some notional change in the person's attitude. The lifestyle is changed. So then this change will happen in the in his physiological level, and this disorders will be addressed in totality. Okay, so asthma treatments, and then similarly other disorders are there which we have we will just quickly go through the other few disorders, and then we will go to the basic theory of how the disease and how the disease is addressed, because that is very important. As a yoga therapy student, we will have in the end just a few minutes on the other disorders. Just a few slides we will go through. So bronchitis is there. Bronchitis in the, say, chronic inflammatory disease, the bronchitis, and again it is triggers are there, smoking, air pollution, all this. So bronchi level, so this swelling and the symptoms, the prolonged cough and mucus formation. So basically what happens? Basically the same thing, the air path getting disturbed. Okay. So then COPD is their chronic obstructive pulmonary disease, which is more serious and degenerative type of disease. So this, just a minute. So here also the symptoms say are there, cough, then chest tightness, all these symptoms are there. Basically, the path is getting narrowed down. Path is getting degenerated. So so for that we have to address from the mind. So mind, why from the mind? You should not have any doubt in that. So this you are addressing the nervous system. You are addressing the sensitivity. You are addressing the harmonization of the system. Okay, so like this. So then other allergic diseases, disorders, rhinitis. So the sinus, this hair swelling, and this inflammations are there in the swelling in the mucous membrane of the nose. So here also again it comes to the path, or again it comes to the swelling or inflammations there. So here, so what happens is oversensitivity and allergy, and the running nose, sneezing, all these symptoms are there, and cause can be common cold, allergy. Then different modern medicines for decongesting medicines are given, but you have to address the root cause. You have to address the basic sensitivity of the person, the brain, the mind. You have to address. Sinusitis is there. Sinusitis there also. This inflamed. The linings are with inflammations, and healthy, and this with the disorder. You can see the difference. Excess mucus is there in all the time. Then cold, or say sometimes this virus and this bacteria also. So it's due to that. Then we are giving the antibiotics, antimicrobial medicines are given for this anxieties. But again, it is coming the next time again. So it is getting in a vicious circle. So, but rather than in what you have to do in yoga therapy you have to have the immunity. So for all this, and then you have to have the sensitivity, or no oversensitivity should not be there. So you are addressing the mind part in yoga therapy. Whereas for the symptoms, there are treatments for this. For immediate relief, of course, have the medicines for the immediate during the attack of any of these diseases, especially asthma and all these. Most of this, we have to have the medicine for getting relieved. Further, we can have the yoga, because yoga practice is a very effect of yoga practice is very slowly only. One has to learn properly and then go to the state, and already you are in a weak condition. The yoga patient comes to the yoga therapist, so already in a weak condition, so it takes more time. So we have to have the modern medicines also, but at the same time we have to slowly switch over to the yoga therapy. Then this during the sleep, then snoring, and then you are getting the breathlessness. Say you are stopping the breath. Breathing is getting stopped, the blocked. So this obstructive sleep apnea is a very common. So it is a in many. It is a part of many other disorders like obesity and then other disorders. And so this also again a muscular change. Muscle is getting relaxed in the top, and then it is getting closed. So that occasionally it is getting closed, and then say the momentarily no breathing is not possible to breathe, is blocked. So then again breathing starts. This unconsciously it is happening, because during the sleep only it is happening. Then what happens? The person to lie down, not in the back, the the prawn position, or like that, change the positions, and then like that some changes also will help to some extent. And then otherwise this surgical treatments and other things we have to do. But for in yoga it will have effect in the muscular level, and we can have a lot of relief. Certain practices are there, certain pranayama are there. So all this will help in the OS, this obstructive sleep apnea. So here symptoms, loud snoring and breathing, stopping the breath. But if person will not know, then the sleep will not be proper. The person will be very weak, very weak, and then will not have the energy in the daytime. So awakening, if person is getting disturbed, the sleep is getting disturbed. The sleep is the one of the most basic thing for requirement. Then this sleep apnea we can have with say in yoga therapy, we can very clearly we can address with pranayams and then other practices. Cause of the sleep apnea, that muscle back of the throat, no, that is getting relaxed and it is getting obstructed. And so these practices, say decongestion, some allergy medications are given, otherwise surgical and other things. But this will not give a root cause. It's basically from the mind. If you can address all these issues, all these disorders, that will have a long-stand permanent. But it will take time. The yoga therapy has its own limitations. We should not be very much these things. Everything there is as a yoga therapy, as a yoga therapist, we should know the limitations of yoga therapy. You will be knowing the limitations of yoga therapy also. We should know, and then we have to slowly introduce to this say the patient in a slow manner and then properly, and in the steps we have to address. So it is a slow process that we have to recognize. Now, this is the basic what we have discussed. We have discussed the fundamentals in the respiratory system, how physiological, anatomical, in brief, and then what are the disorders, the respiratory system disorders. That is what we have discussed, and briefly we have discussed the symptoms and what are the what are the symptoms of this, and then how it is addressed in general. So that is what we have discussed. But in yoga therapy we will discuss in detail what in say for asthma and for this respiratory system disorders, what are the modalities that we will discuss in an integrated approach of yoga therapy. We will discuss a few points. We will discuss. So till here, if anything is there, you can ask. We will go to the further.
We'll take your question and answer later on, sir. After.
Okay, sir. So there is, say, we will have a few points in brief also, because say, the fundamental of the yoga therapy, the yoga therapy, yoga means what? Yoga is, you are addressing the mind, chitta vritti nirodha. The Patanjali Yoga Sutra, the fundamental text on yoga. So the basic definition, the basic point is you are addressing to the mind field. Chitta is the mind field. Okay. So you are regulating the mind. How you can regulate, how you can address the mind? You cannot address, no, in how you can address. There are some, so one is through body you have to address. Through breathing you can address. So breathing is voluntary and involuntary, no? So if you are able to breathe, okay, if you are if you want, you can change, you can modify the breathing, otherwise it will happen automatically. So if you are controlling the breathing, you are controlling the mind. So in asana, pranayam, everywhere this happens. There is a voluntary, involuntary, and then through voluntary, you are going to the involuntary, the unconscious levels. Or the brain, the mind, in the modern science we call brain or mind means what? Mind is brain. It's a material level. It is discussed. Say brain or spinal column, nervous system. So, but this okay. I mean, even in that case. So, what you are, how you are addressing, how you are making the changes. So, changes is like this. So, from the voluntary to involuntary, we are making the changes. So, addressing the mind is one of the major thing. One is the main thing in the address the mind. So, and okay, the mind. Very interesting thing. This mind has different states of mind. We know this mind is in a different, let's say, different mood swings, and many are there. No, so Patanjali also says there are 5 states of mind. Is there 5 states? So which is Mudha, Kshipta, Vikshipta, Ekagra. Ekagra is concentrated, and Niruddha, restricted. So one can experience oneself different states of mind. What state of mind I am right now? And then that state, whether it is conducive for yoga therapist, yoga for minimum, for doing minimum, say he or she should have the internal awareness. So awareness is the key of all yoga practices, So to have the minimum this internal awareness, we should be in some state, some level of mind. So So that is also required. So the mind state is also required for addressing the, say for practicing the yoga. Minimum some mind level is mind state of mind is required. So for that, various practices are there. The different levels of practices are there. That is why variety of practices are there. So that is why we start. We may start with the kriyas. We may start with loosening practices. We may start with yoga. Walking is also there. Siddha yogis do walking. So say these are say depending on the state of the mind, you can select some practices, and then slowly, slowly you can come to the concentrated mind, and then you can go for the full fledged. So these all will be useful in the yoga therapy, because now you are dealing with the person who are coming first time doing. I am doing first time yoga. Okay, then the person is already having some disorder. In that case, we are addressing. So you have to very, very slowly take him or her to the yoga practices. So integrated approach of yoga therapy. So that also will have few points. So the see. In the modern medicine, we are just seeing the physical body, the Annamaya Kosha we are. But as per the yogi concept, there are different levels of subtler levels of Sukshma levels are there. Much more subtler levels of existence is there. There is a Pranamaya Kosha and Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha. So these 5 levels of consciousness are there. And how the disease comes, how the disease originates. This has been discussed by the sages in centuries, in a long, long time. And in this, many, especially in the Yoga Vasishtha, it is very beautifully it is given. So the beautifully it is given in the, different categories of the from the stress, Adhija Vyati and Adhija Vyati, how the categorization is given. So Adhija is originating from the mind. So whatever diseases originating from the mind, okay. So these all we can address very effectively in the yoga. This concepts of consciousness levels, that is from Taittiriya Upanishad. This Panchakosha theory is from the Taittiriya, one of the ancient Upanishad. It is from there. So these Taittiriya Upanishad and the Yoga system, these give the basic fundamental philosophical basis for the yoga therapy. So this you know that what there is a model. You know, in scientific research also, wherever say we are discovering, we are going to invent, we are going to discover, explore something which is unknown. No? So what is the method they use? So there will be some model. Model will be there. So some model, and that there is some mechanism. Okay. So you know the how this is working. We know. So say for example, any invention, you can say the atomic model or different. No? So there is a model, and then there is a mechanism. So here also in yoga also we can see that there is a model, Panchakosha model. Panchakosha, there is a Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha, different koshas are there. And this we cannot see that. We cannot physically, one cannot see. Okay, where is the starting of Pranamaya Kosha to Manomaya Kosha? If somebody asks, no, we cannot show. But this is a model, theoretical model. There is a theoretical model, but there is a mechanism. So the function we know. So if it is there, if we are aware that if there is a disturbance in the Pranamaya Kosha, that is getting reflected in the Annamaya Kosha. That we know. That mechanism we can explain. With that we can, so this model and like this model and mechanism is there, and with this help we are explaining this theory. So in the yoga therapy, this Panchakosha model is very fundamental. So how you say that? Because effect is there. Say if somebody asks you, you are a yoga therapist, show me what is the Manomaya Kosha. So this is a model. This is a theoretical model, and I have the effect of this this working effect of this theoretical model. I can explain, and it is a practical, it is an actual thing. Okay. So with that, I am validating the theoretical model. Okay. So it is all inventions are coming like this. This atomic model. You are not seeing the proton, neutron, electron, and all. This is a theoretical model. Some scientists have made the theoretical model, and but the effect of that we have found with our experiments. Similar thing is there in yoga also. That is what I wanted to say. So Panchakosha theory is a very fundamental to our yoga therapy, and from the yoga, this Taittiriya Upanishad, it has come, and then this categorization of disease. Say there are two types of in yoga system. There is a categorization: Adhija Vyadhi, Anadhija Vyadhi. Adhija means from the mind. Anadhija is outside, beyond that. Say some external reasons due to that, some disease or some miseries are coming. So that, and in Adhija also there is a subdivision. There are two things. One is Sara and another is Samanya. Sara is the essential, so which you cannot avoid, like birth and death, and then suffering due to that, due to the miseries, of rebirth and all, all that is a essential thing. If you are born, then there is a death is there. But there is another thing, Samanya. The Samanya is the general thing that we are addressing. So what we are addressing to the Samanya category of this these diseases. Samanya category we are addressing in yoga therapy. So this is from the yoga system. So Adhija and Samanya. So this is where we are addressing. Okay. So we are addressing the mind, and various practices are there. So we'll go to further on these aspects. So these, I think we will not discuss now. There are various obstacles of for the yoga, for doing the yoga. Also, these obstacles are also valid for yoga therapy. All this because
Yes, we can
finally,
move forward. We can move.
we can move. We will discuss some other point of time. So then. This is what I have discussed now. There's just a refresh. The yoga system, Adhija and Adhija are there. Adhija means from the mind, that is from the stress, and then Adhija has two components. One is Sara and Samanya. So we are addressing all non-communicable diseases from this perspective, from this point of view, and different levels of consciousness we have seen, and then. Most important thing is active participation of the patient is required as per the yoga therapy modality compared to the other modalities. So here in other things you have to just take a medicine or something. Just so here full attention, full with a complete internal awareness is required. So that is in yoga therapy. So yoga practices. So we'll go for the we will see in general few practices, and then the integrated approach of practice we will see. Then one or two we can discuss in detail also. So that we have planned. So yoga practices for the asthma, very effective practice. The chair breathing, say sitting, say the not on the chair, say sitting the chair straight, then and supporting the head. And then say you are breathing, various practices we can have. So you can have chanting along with exhalations, all this. So then Shithilikarana Vyayama, various kriyas, asanas are there. And then various practices of say asanas, and then asanas, various different types of say forward, backward, bend, all this we can have. Then pranayama, it will balance the prana. Relaxation will say relax the involuntary muscles. And as I told, no, voluntary and involuntary. So the involuntary muscles you have no control. So but how you go? You go from the voluntary. So like that. So like breathing. From breathing you are going to the mind. So then voluntary muscles you are going. Voluntary muscle you have a control. So there we are say slow, smooth, rhythmic. So all this, you are controlling that. So once you control, then this control. There is a controller and controlled. Okay, observer and observed. Okay, so control. So you are controlling this. Then who is the controller? The brain. No. So the brain also you are getting controlled. So IAVT module, integrated approach of yoga therapy module for asthma. So breathing, various breathing practices are there. You can focus on these points because say the practices for the asthma, breathing practices, various breathing practices like a hands in out practice, hand like this, no hand. It's a very simple practice, hands in out, then hand stretch in the standing position, angle stretch. Then this Marjarasana is there, Marjarasana, no? This Marjarasana, all those practices, similar, this tiger breathing is also there. So it is also different, focus is slightly different, but so these practices, rabbit breathing, dog breathing, so all this we can incorporate. But when the person is not having the problem, when attack is there, you cannot give these practices. But when the person is normal, that time slowly we can give, and then these muscles will get strengthened. So we are focusing on the various groups of muscles. Okay. So Shashankasana, straight leg rising, all these practices we can give. Then instant relaxation technique. So instant relaxation technique, what we are doing, IRT. So instant relaxation technique, generally it is done in the lie down position, in the Shavasana position. So you are, what you are doing, you are tightening the body parts. So it starts from the toes to the top of the head. So you are tighten the toes, tighten the soles, tighten the heels, ankle joint, calf muscle, pull the kneecap, tighten thigh muscle, squeeze and compress the buttocks, tighten. Exhale completely and pull the abdomen, tighten, make a fist, inhale and expand the chest, tighten head and facial muscles, tighten. So you imagine from the toes to the head, completely tighten, few seconds only, just say 15 seconds, 30 seconds, just that much, or 1 minute. Tighten, 1 minute, and then release, completely release. So stimulation and relaxation, stimulation, relaxation. You are tightening the whole body, all muscles are tightened. Then release. See the effect. Physical. Personally, you can see you are do the practice. It's a very simple practice. At the same time, highly effective. And then what happens? You are stimulating, relaxing. Then do more number of times. Stimulate, relax, stimulate, relax, stimulate. So what happens? The mind, mind is in one level. It will go slightly up, then come down very much more. It will come down again, slightly increase and come down. So slightly and then come down, and then you will come to the minimum level of stress. So this is the principle used in the cyclic meditation. So it's a part of cyclic. IRT is a component in the cyclic meditation, one of the advanced techniques. So this IRT, instant relaxation technique, is a highly powerful technique. One can use this, and it is for the whole body. Without attention, you cannot do this practice. So many of the practice, so like this IRT and all, we cannot do without attention. So if you are thinking something else, you won't be able to do the practice. But at the same time, so simple. So a few minutes only, instantly you can relax the whole body, the whole muscles, all tissues relaxed. So that is IRT. And then say QRT. Other practices are there. Loosening practices, forward, backward, side. Pavanamuktasana Kriya is there. Pavanamuktasana Kriya, you may be knowing. Pavanamuktasana is there. And in the Pavanamuktasana Kriya, you are folding the one leg. Say, for example, the left leg folded in the Pavanamuktasana position and the chin towards the knee, and in that position. And then right leg you are straightened, and then you are raising and then rotating clockwise and anti-clockwise. Clockwise a few rounds, 3 to 5 rounds, then anti-clockwise 3 to 5 rounds. With complete awareness, eyes are closed. Okay. So then releasing that and then going for the other. So with complete awareness you are doing. Awareness means what? Awareness means what? What is meant by awareness? If you are telling to one patient who is coming, do with awareness. So what he or she will